Sporty's courses aren't just for independent studying. A comprehensive flight instructor portal connects CFIs with their students' at-home study sessions, making the flight training process more organized and efficient. This suite of tools includes detailed progress sharing with students, lesson plans, a flight instructor refresher course, a complete FAA library, and access to Sporty's courses. Best of all, every feature is available free to any active flight instructor.
And we're live. Welcome to MentorLIVE number 77, our monthly free service of the National Association of Flight Instructors to help you, the instructor, maximize your success and help maximize your students' outcomes as well. My name is Aaron Dabney. I'll be your host this evening. I am a master flight instructor. I get to serve on your board of directors, and I get to have a lot of fun helping to put this program together every month. I'm glad you're here. Before we go any further, I want to thank this month's generous sponsor, Sporty's Pilot Shop. I was telling my wife today, Sporty's has been with me every step of my aviation career. And even back to when I was a kid in elementary school, I remember Christmas and birthdays. If the box had that Sporty's Pilot Shop packing tape on it, when you opened it, you knew it was going to be a good day. So thank you so much to Sporty's both for the support of MentorLIVE and for NAFI in general. So we have a very important topic this evening. Dr. Vogel is going to be presenting on clinical aspects of pilots' mental health. And I do want to acknowledge, if you watch NAFI social media or if you get email comments from NAFI, you've noticed that there's been a decent amount of back and forth in the past week or so about whether or not this was a topic that we need to address right now. And I want to let you know that the conversations about this went to some pretty high levels within the FAA, and we're presenting this tonight with the support and encouragement of the FAA to go ahead. So we want to acknowledge that and make sure that you're aware of how much we appreciate their support and cooperation. As a matter of fact, we all agree this is an important enough topic. Not only is it eligible for Wings credit, but tonight's broadcast is also available for AMT credit, which we're not able to do that often. Don't forget, if I'm going to tell you, if you're not a NAFI member, join NAFI. The benefits are numerous, and there's more coming. We've got some surprises in store later in the year that will really upgrade the membership experience, and you're really going to like them. Don't forget to visit Sporty's Pilot Shop, either through their website or through the sponsor info on your broadcast page. Don't forget to go get that Wings credit. It's a simple two-step process. Take your quiz, get your Wings credit, show it off to your friends. I do want to give a little disclaimer, though, just to make sure that everybody's aware of what the scope of the program is tonight. Dr. Vogel's not an AME. Neither one of us work for the FAA. So we're here just to talk about clinical aspects of mental health and things that we as instructors can do better as far as noticing things with our students and helping them get help. So we're not going to be commenting on or opining about the work of the committee that's ongoing right now about rulemaking about AME stuff. This is strictly about the instructor tonight. So if your questions or comments about those topics don't make it to the air, you'll understand why and hopefully not be offended. Again, topic tonight, Dr. Victor Vogel's clinical aspects of pilots' mental health. Let me introduce you to Dr. Vogel. If you haven't had the opportunity to hear him speak, you're in for a real treat. Dr. Vogel also serves on our board of directors. It's a lot of fun to work with. He has been for a long time a board certified medical oncologist, specializes in breast cancer. He's a pretty smart guy. Dr. Vogel earned his MD from Temple, did his residency and fellowship at Johns Hopkins. He's been a vice president for research for the American Cancer Society, and that wasn't enough, so he earned his CFI, CFII, AGI, and IGI, and serves as a FAST team representative, and has founded a STEM program in Pennsylvania, Susquehanna STEM to the Skies. He's also an active pilot and aircraft owner. Owns a Cirrus now. I know that's not your first airplane, Victor. And how many states have you flown to now?
I think the count is 40 and counting.
40 and counting. Yeah, definitely goals for me. So I'm glad to have Dr. Vogel on board once again. So without further ado, Victor, I'm going to go ahead and turn the flight controls over to you.
Thank you, Aaron. Um, we need to stop pilots killing themselves and others in our airplanes. And I'm going to show you what I believe are simple things that every flight instructor can do to be aware of the warning signs of mental illness and do the very simple and practical things that can help people that are afflicted with this medical problem. And I'm certainly going to try to remove some of the stigma around mental health and the underreporting that occurs. So let's start by looking at some recent history. Um, if I can get the slides to advance. So many of us know about this unfortunate incident in Germany with the Germanwings flight 9525, which occurred in March of 2015. This was an Airbus 320 that was flying from France to Dusseldorf, I believe is where they were headed, um, or Barcelona. They left Barcelona and were headed to Dusseldorf. And there was a co-pilot on board named Andreas Lubitz. He was 27 years old, and he had a history of being treated for suicidal tendencies. And his primary care physician declared him unfit to work. But that information didn't get back to the airline. And Lubitz himself kept this information from the airline, and after they reached cruise altitude on this flight from Barcelona to Dusseldorf, the captain was out of the cockpit, and Lubitz locked the cockpit door and essentially did a controlled flight in the terrain, and everyone on board perished. Um, that kind of got everybody's attention. But then very recently, I hope you've all seen the January, February issue of NAFI's Mentor magazine. And it has a rather disturbing cover with red letter title here, When Instructors Crash. And there was a very unfortunate accident back in September of last year, September of 2023, when an instructor who was really exhibiting a number of the dangerous behaviors and was recording a lesson with a student on his iPhone. And the instructor was actually abusive to the student. And he had these hazardous attitudes. And he was berating the student and making inappropriate comments. And the student was doing the best he could, and they went off on a night flight. And this unfortunate in, instructor led this training flight into a supercell, and the training aircraft, the pilot and the student, the instructor pilot and the student, both perished in that crash. So these kind of events get all of our attention, and um, even more recently, just within the last 3 or 4 weeks, there was in East Texas an apparent suicide in an airplane where a student at the ATP flight school at the Addison Airport in the Dallas area, this 23-year-old student, Logan Timothy James from North Carolina, um, he got into one of the flight school airplanes and took off at 7 p.m. in the dark. And the ground track on the ADSB showed a rapid descent after he had climbed to a cruise altitude of over 4,700 feet a minute. And the aircraft impacted the ground 9 miles northeast of the town of Telephone, Texas, about an hour after he had taken off. And there was a very sobering recording of the conversation, somewhat one-way conversation of this disturbed young man talking to ATC in Addison Tower. And he essentially said he was climbing through the clouds, and he was going to head outside of everything, whatever that meant. And about right now, you'll realize I'm not going to listen to y'all. And I'm headed to East Texas, and I'm career track, and I'm going to uh, pull the COM1 circuit breaker and the COM2 circuit breaker. You're not going to be able to talk to me. And after that conversation, he intentionally, we believe, intentionally crashed the airplane and killed himself. So these are the incidents that we absolutely need to stop, and we need to identify um, pilots who are at risk and learners who are at risk from this sort of activity. Well, this is the picture we all want to have of pilots, happy, joyous people, loving flying and doing their jobs. And what we're going to do now is I'm going to put on my epidemiology hat, and we're going to look at the prevalence of mental illness in the population. And very often it's hidden behind smiling faces. And there's a lot of underreporting that we're going to talk about. And we're going to identify ways that we flight instructors can help individuals who are struggling with mental health issues. So the FAA is certainly concerned about this, and there is an entity at the FAA called the Aviation Rulemaking Committee. And after that Germanwings crash and the Malaysia 870 crash, this committee was established to assess pilot fitness and how FAA should respond to these sorts of accidents. And the FAA is taking action in these areas. And some of the early recommendations that came out of the Aviation Rulemaking Committee was that we needed expanded training in mental health issues for our aviation medical examiners. I am not an AME, but I know with talking to AMEs that I interact with on a regular basis that this training is ongoing. And the rulemaking committee also encouraged that we have pilot and peer support programs, particularly in the airlines. But also, I think it's important for organizations like ours and other organizations in the general aviation community to raise our awareness of the issues related to mental health and the impact it can have on pilot safety. So that's really what we're going to talk about for the next 30 or 40 minutes. And the rulemaking committee came out with a report that was published in late 2015 after the Germanwings crash. And that report, that initial report, said that the best strategy for minimizing the risks to pilots, what they called mental fitness, and we can use the terms mental fitness and mental health interchangeably, was to create an environment that encouraged a supportive atmosphere for pilots to have voluntary self-disclosure. What does that mean? Well, when we go to our physicians depend on us to being honest and accurate in recounting our symptoms and our concerns. And what we're learning about mental health is that for a number of reasons that we'll look at here shortly, that there is underreporting of mental health symptoms, both to primary care physicians and to aviation medical examiners. And we know that there's barriers to this so-called self-disclosure. And self-reporting is perceived by some as a high-risk situation, and it may be perceived, particularly by professional pilots, but also by general aviation pilots, that confessing mental uh, illness or mental health symptoms might end a career or might end one's training as a pilot, even if one's not on a professional pilot training track. And so the pilot community, according to this initial report from the Aviation Rulemaking Committee, um, they said it was important that our community of pilots and particularly flight instructors receive support and information that's timely, accessible, and accurate. And that's exactly what we're going to try to do here tonight, is to give all of us instructors information that's practical and usable and that you don't have to be a medical professional to use. Um, and that we receive report from our healthcare providers. And I know the AME community is weighing in on this. And I believe also the primary care community that provides the healthcare to our pilots is also becoming more aware of the need to be more tuned into these signs and symptoms. So, and the best approach, according to the rulemaking committee, was to address these misperceptions, to expand the support programs in the pilot communities, and um, to instruct all of us about issues related to fitness for duty. We all know that you're not supposed to fly when you have a fever or when you're taking certain kinds of medications. Well, it's also necessary that we be able to identify mental health conditions that make it unsafe for pilots to fly, and that we promote and encourage pilots to report these symptoms in a confidential way, without stigma, and in a safe and supportive environment. So let's talk about mental health as a public health problem and how it affects many of us, and sometimes goes unnoticed or unwitnessed. And we're going to try to point out how we can be more attuned to this. So this is a survey, a prevalence survey. Prevalence means how many cases are in the population at any moment in time. So it's sort of a cross-sectional look at the population, and this was done by a government agency, the National Institute of Mental Health, and they sent out a survey. And as a result of this survey, they estimated that, look at that number, nearly 58 million adults between the ages of 18 and older in the United States had any mental illness in a single year in 2021. And that number, 58 million, represents nearly 23% of all US adults. So it's at least 1 in 5 adults that in any given year had some signs or symptoms of a mental illness. And the prevalence of illness was somewhat higher in females at 27% than in males at 18%, but that may represent underreporting by males. Remember that women have more contact with the healthcare system because of childbearing and because of medical issues that are prevalent in women, and men have less contact and may be reluctant to divulge symptoms or report signs and symptoms than are the women who have regular contact. So even though there's this difference reported in this prevalence survey between men and women, I think the prevalence in men may be higher than 18%. But even at 18%, that is a significant number of individuals. Now, young people between the ages of 18 to 25, and for many of us flight instructors, that's the majority of our learner population, they had the highest prevalence of mental illness. And look at that number. It was a third of people between the ages of 18 and 25 in a single year had any mental illness. And we'll describe mental illness and what that means in a moment. And then for middle-aged people, younger middle-aged people between 26 and 49, it was more than a quarter, it was 28%. And for us mature folks, 50 and over, the rates were a bit lower at 15%. Some of that may be because as we get older and get more life experiences, we may be better able to deal with some of the life stresses that can lead to mental illness, but those are the numbers. Um, and There was a survey on drug use and health in 2021 that was very similar, and it looked at those 58 million adults with any mental illness and found that 47% of them had received health services in the past year. Now, you might say, well, that's good news. 47% were receiving some sort of treatment for their mental illness. The flip side of that is that 53% were not. So that there's a lot of mental illness that either goes unrecognized or untreated. And once again, more women, about 52%, received mental health services than men, but even among the men, it was 40% of that 57, 58 million people with any mental illness. And young adults, again, 18 to 25 years of age, had a little bit more mental health services at 44%. And the solidly middle-aged folks, the 26 to 49-year-olds, nearly half of them got treatment if they were affected with mental illness. And even those 50 and older, nearly half of them got treatment. But look at this last statement. Serious mental illness occurs in about 5% of all US adults every year. So, and we'll define what serious mental illness is in a moment. But that's 1 in 20 people every year year after year have serious mental illness. So this is not a problem that's rare. It's not unusual. It's very common. And we need to be aware of that. And we need to be alert to the signs and symptoms. And that's what we're going to talk about. So one more survey. Among the 14 million adults with serious mental illness, 9 million received mental health treatment. Now, serious mental illness, we'll define in a moment. Um, that's 65%, but it says also,
Okay. I found this on the web for spell illness will define in a moment.
excuse me, my iPad is having a little seizure here. Um, the it means that a third of the people with serious mental illness, um, and that's about 5 million people, did not receive any treatment. And treatment was defined in this survey as having received inpatient treatment or counseling or outpatient treatment or counseling, getting a prescription medication for problems with emotions, nerves, or mental health. So broadly defined um, mental health treatment.
Hey, Victor, real quick before we move on,
Yes,
going back to the prevalence survey,
yes.
Andy asks if there was any attempt to control, or do you know if there was any attempt to control for a cultural or generational willingness to self-report?
That was not specifically reported, and the survey was representative. Well, we saw it was representative of age. It was also representative of geography and ethnicity. So it was all parts of the country, and it included all racial ethnic groups. But I don't know that there was other attempts to delineate the data more closely than that.
Got it.
So where does this come from? Um, well, mental illness in general is caused by a variety of genetic and environmental factors, as many medical conditions are. Um, and part of it can be genetic. Um, and there are environmental exposures before birth in utero that can change brain chemistry and can affect the neurotransmitters. So neurotransmitters in our brains, we have neurons, nerves that talk to each other, and they talk to each other by sending these chemicals called neurotransmitters. And think of those as baseballs. And then there are receptors that think of those as catcher's mitts. Those catcher's mitt receptors get they receive those neurotransmitters, and that's how we get messages in our brain, and that's actively going on all the time in millions of neurons in our brains and peripheral nervous systems. And those chemicals, those both the receptor chemicals and the neurotransmitter chemicals, can be affected by genetics that interfere with their production in normal physiology. So when these neural networks are impaired, the function of the receptors and the systems change, and that can cause symptoms like depression, anxiety, sleeplessness, and obsessive compulsive behavior, all sorts of things. So mental illness is more common in people whose biological relatives also have a mental illness. Now, most families, if you ask, if we physicians ask about family histories, it's pretty easy to find in most families people who have been depressed, people who have been alcoholics or substance abusers. So these things are not rare. And for many years, it was just something that wasn't talked about. It was very hush hush and quiet. And that's where part of this stigma comes from. And that's one of the things that we have to work to change. Um, let's see the next slide. So these are data from the Mayo Clinic, recommendations or indications of factors that might increase the risk. As we said, a history and a blood relative, stressful life situations. Now, we've all had those situations. I can remember as a first year medical student being very anxious and being very concerned. Was I able to do this? Could I get through medical school? Could I deal with the workload? And that was a very anxiety provoking time. But things like financial problems, job loss, the death of a family member or a friend, marital problems, divorce, separation, all of those things can impact our mental health. Chronic medical conditions like diabetes or other physical conditions can bring about mental illness. and brain damage from things like a concussive blow, car accidents, falls, any kind of head trauma can lead to signs and symptoms of mental illness. Traumatic experiences, the most notable being our military who are in combat situations and suffer from post-traumatic stress disorder. Um, Using alcohol or recreational drugs can also lead to mental illness. Um, Child abuse. Um, Children who are abused grow up as adults with a number of mental health problems. And that slide changed before I wanted to. And uh, having few families or friends, the so-called loner, the hermit, the isolationist, or someone with a history of previous mental illness, a history of anxiety, depression, hospitalization, treatment, they may be more subject to future events. Now, you might ask, well, how common is this occurrence of mental illness in airline pilots? Well, here's two studies. One 2016 study asked airline pilots to take a survey anonymously to assess just one form of mental illness, depression. And interestingly, more than 12% of those airline pilots were managing depression, either with outpatient therapy or with medications. And 4%, 1 in 25 of these airline pilots reported having suicidal thoughts without treatment. Why? Because they feared a negative impact on their career. This is the stigma that's associated with mental health conditions like depression. And they were fearful that if they reported that they either had the symptoms or that they were receiving treatment, they might be furloughed from their job, might lose their job, or it might have some serious impact. Then there was another study in 2019 of pilots seeking health care, and more than a third, 38% of pilots feared losing their medical certificates and reported withholding information from their physicians. And this could be all kinds of information. We can withhold information about the symptoms we're having or the over the counter medications we're using, or even prescription medicines that we can now get through the internet. And very often these things are not reported. And so we have to encourage all of our learners to report these things. Now, this was a very important document. This was something that was commissioned by Senator Dianne Feinstein from the state of California. And she asked the Inspector General in the Department of Transportation to do an assessment of the situation regarding pilots and mental health changes. And this report was published by the Inspector General in the Department of Transportation. And they noted and they learned, fortunately, that the FAA has comprehensive procedures to evaluate pilots' physiologic health and psychological health. And the AMEs, the aviation medical examiners, are being taught specifically about the recognition and the management of mental health issues. And the FAA has an extensive and structured process to evaluate pilots' psychological health. And that was something that was reassuring that this Inspector General's report identified. And the FAA's ability to mitigate safety risk was limited once again by pilots' reluctance to disclose mental health conditions. So, one of the things we need to encourage the pilots that we see, whether they're certificated pilots or our learners, is that if they have signs and symptoms, and if they've suffered trauma that we may know about, they tell us about a death in the family or about some family problems, some marital or divorce problems, or whatever it might be, that we be aware of those things, we be receptive, we be open to listening, to hear about those concerns, and then we steer them to the help that they need. And we'll talk about that in a minute. So, the factors that this Inspector General's report identified as discouraging pilots from reporting their health conditions were three things primarily. One, we've already mentioned the stigma associated with mental health. Now, I can assure you as a physician, I was a cancer doctor, but I saw many patients who either preceding their cancer diagnosis or following their cancer diagnosis had a history of mental health issues. It's very, very prevalent, as we saw in those survey data. And we we always endeavored in clinical medicine not to judge the presence of mental illness, be it depression, anxiety, phobias, obsessive compulsive behavior, whatever it was, manic depressive illness, not to be judgmental any more than, we weren't judgmental about people who had heart disease or diabetes or kidney failure. We need to have the same opinion about mental health that we have about the other conditions that we're all subject to or at risk for. And this concern, particularly of professional pilots, but it would even be in general aviation pilots, about the impact on their careers. Pilots may be fearful that if they report these symptoms, even if they're not a professional track training pilot, that they could lose their FAA certificate. Or particularly for the professional pilot population, this fear of financial hardship, losing a job, losing a source of income. And the report from the Inspector General last July said that addressing these barriers is critical for the FAA, and the FAA is doing just that right now. Now, one more slide to reiterate what this report of the Inspector General last July reported, that the primary factors discouraging pilots reporting were, as we said, stigma, impact on careers, and financial hardship. And that highlighting the importance of these factors, particularly this fear of financial hardship and the stigma associated with reporting these symptoms, was perhaps contributing factors in the Germanwings accident report. It is unfortunate that the pilot in the Germanwings accident, that his physician did not report his findings of the pilot being not fit to fly. He did not report those findings to the airline, which may have prevented this tragedy. And the amount of time it takes to complete medical certification after a report of mental illness may discourage pilots. Now, I know from speaking with aviation medical examiners that FAA is doing a number of things to accelerate the process, not only for mental illness, but for a number of potentially disqualifying medical conditions, so that pilots can be given, if they need a special issuance or if they need treatment, and then after treatment can return to active flying. FAA is actively working on those issues with the AME community.
Hey, Victor, real
Now,
quick, while we're on
yes,
this item with the IG report, and you might not know anything about this, but I think it's worth asking. It's a real good question. Thanks, James, for this. Um, do we know if there's anything being done in the military, through the Department of Defense, to look at this issue of self-reporting and stigma? Because he's thinking that these factors for why pilots don't self-report sounds really familiar and similar to why people in the military might not self-report.
yeah, I know that the military is very actively involved in identifying the consequences of post-traumatic stress disorder, and my understanding is that the military is attuned to these issues, and they have worked very hard to remove the stigma of mental health and have active programs to get their soldiers and their sailors and their pilots into programs to manage and treat and control mental health issues. And you can imagine that that's important for the soldiers and sailors and pilots, but it's also important for the military because they expend enormous resources
Mhm.
to train and educate experienced pilots and soldiers and technicians of all sorts. And to lose those people is a great detriment to the military. And so they are actively involved in trying to wherever possible, to keep those folks at their duty stations and involved. I don't know any more than that, but I am relatively certain that the military is very much tuned into these issues and is very actively working to support individuals who are affected with mental illness.
Great.
Um, we mentioned the medical certification process. FAA is definitely working on that. Um, they've also enhanced their database. In the past, the AMEs told me that they used to have to mail paper documents into the regional medical offices for approval for things like special issuances. But now FAA has made it possible. And I recently had a middle-aged adult who was doing private pilot training with me, and he had a cardiac procedure where he had cardiac stents. He had stents in his coronary arteries, and his medical information was uploaded electronically into the system. And that whole process is accelerating the ability to deal with not only mental health issues, but with other medical issues as well. And the AMEs are being trained. And, there was a recent development among the AMEs. There are now treatments, drugs that we use to treat depression that are now permitted to be used by pilots. And that's a recent change, and there will be more changes like that that are coming. And the FAA is upgrading their database to address the recommendations from the ARC committee. And I think we're going to continue to see changes. And the inspector general said, well, the FAA has to continue to address the barriers that discourage pilots. And I think they are doing that. But my message here to my fellow flight instructors is that we must be willing to do that. And we must be willing to help our learners and our certificated pilots in reporting these symptoms and signs and get them to places where they can be helped with their uh, mental health conditions. And this is going to be obviously an ongoing focus from the FAA. And when it says industry stakeholders, read that. The airlines are very much interested in this. Now, here's a fun picture I'll share with you. This is me in clinic one day with one of our nurses. This is Tammy. Tammy was a former flight attendant and then saw the light and became a nurse. And she and I showed up in clinic one day, both wearing purple, which we thought was kind of funny. Um, but we enjoyed it. And this was in a cancer clinic. And you can see we're smiling. Cancer wasn't always a sad or terrible thing, but we certainly saw patients who had a history of mental illness or had signs and symptoms of things like anxiety and depression, understandably, after a cancer diagnosis. And we actively worked to try to identify and help those people. So, what I'm going to do in the next few slides is to highlight the signs and symptoms of mental illness that any layperson should be able to identify. So, again, from the Mayo Clinic, there's something called mild cognitive impairment. Now, I'm convinced as an older individual that some days I must have mild cognitive impairment as I run around the house looking for my iPad or wondering why I wandered into a room. What am I looking for? But it's not actually mental illness, but you have to think of mental illness as a continuum and as a spectrum. So if someone starts to ask the same questions or telling the same stories, now we all have, an Uncle Joe in our family who every time we see him tells us the same story that he's told us every year for the last, 10 years at Christmas. But those things can be normal. It doesn't necessarily mean there's mental illness, but if they become recurrent, or if it looks like there's impaired memory, that can be a problem. Missing appointments. Red flag if we have students and learners that repeatedly don't come for scheduled lessons. Or if you lose your train of thought. Now, I sometimes babble on and wonder, how I got on this rabbit trail. But if it occurs rarely, that's just normal. But if it occurs frequently, that can be a sign of something that's pending. Or if you can't follow a conversation or a movie, or you can't follow the thread of a story, or it's difficult to make decisions. If you see pilots in scenario-based training that have a very difficult time at making decisions or somehow repeatedly make bad decisions, this can be an indication that little more investigation might be necessary. Or we all feel depressed and anxious or frustrated at times, but if it's repeated and if it's recurrent and if it's persistent and it doesn't have an obvious cause, it's not because of a family illness or a death or someone's life situation that's troubling us. If it doesn't seem to have an obvious cause, that's when we need to take notice. Now, the signs and symptoms of mental illness, remember that was mild cognitive impairment, but we all have days when we're feeling sad or down, but if it's a repeated problem and somebody has that hangdog look every day or every time we see them, that might be an indication that some sort of intervention is necessary. Confused thinking or reduced ability to concentrate if they just can't focus on the task, or having fears or worries that are extreme, or they have guilt that's out of proportion to something that happened, if they feel they're causing things that weren't their fault, or they have these recurrent fears or worries. Now, we all have certain anxieties about certain kinds of flights. I mean, flying in the winter in Pennsylvania in the ice is something that raises some fears or concerns, but that's appropriate. But if those fears or worries don't seem to have a necessary cause, that's a sign that something maybe need to be done or further investigated. Mood changes. People that have swings in high and lows. One time they're high as a kite, next time they're low and depressed. That can be a sign that something's wrong. Um, Repeated tiredness. Now, the older I get, the less energy I have. I could work for 30 hours as an intern and get through that 30 hours. If I work 8 or 10 hours now, I'm exhausted. But if it's tiredness that's beyond the the situation, if there's tiredness without energy expenditure, or people that seem to be detached from reality, especially if you see delusions. I mean, if people have wild, crazy ideas, or and especially if they have hallucinations, that's a sign of serious mental illness. Or they can't cope with simple problems like excessive frustration with things like traffic jams or the weather, or trouble understanding or relating to other situations. If someone hears about someone else's misfortune and they just don't seem to have any empathy or sympathy about it, that's a concern. Or certainly alcohol and drug abuse, um, changes in eating habits, people who stop eating, um, or sex drive changes. And that can be hard to get to because we're not often talking about our sexual problems, but somebody may bring it up. Or if they have anger or hostility or violence that seems to be out of proportion to the precipitating events, and especially if they have suicidal thinking. If someone says, I really think I want to kill myself, that is a red flag waving, and we ought to be attuned to that. Sleep or appetite changes, mood change, these rapid changes. Now, again, we all have down days. We all have very happy days. I remember the day my daughter got accepted into medical school, or my son was elected captain of his lacrosse team in college. Those were very happy and elated days. But then there's down days when I lost a patient as a physician. Those would be sad days. But those kinds of things are part of normal life. But if these changes in ups and downs are dramatic, that's a sign of potential mental illness. And these are recommendations from the American Psychiatric Association. If somebody seems withdrawn, if you have a learner who sits in a corner and doesn't engage with other people, doesn't talk to airport personnel, doesn't talk to other students or learners, doesn't interact with other flight instructors, that may be a sign. Or a drop in functioning. They've been doing well, and now all of a sudden they miss lessons, or they come unprepared, or they can't pay attention during a lesson, or they seem to be not hearing what we're saying. That's a red flag. Um, Problems with solving, as I said, if we do scenario based training and they can't concentrate, or they don't seem to be able to process events or data that we tell them, or they're highly sensitive. Anyone who breaks into tears, or who wells up and can't speak, and has that much emotion, that may be a sign of a problem. Or if they're apathetic, if they just don't seem to care anymore about what's happening, or they're late for a lesson, or they didn't do the assigned homework, or they just don't seem to have any concern, or feeling this disconnected, that they're not interacting with others, either their instructors or other learners that may be part of the school. Illogical thinking, nervousness, and nervous habits like pencil tapping, or fidgeting, or unusual behavior that's odd or uncharacteristic, or changes in the world. You see somebody you've known them for weeks or months, and all of a sudden their attentiveness to their training changes. They're absent more, their performance declines, they have difficulty interacting with others. These are signs and symptoms that should tell us that it's time for some intervention. Not intervention from us, but we flight instructors should refer these affected individuals to places where they can receive proper help. So, where does that leave us on this road to mental health? Well, I think there's a couple of things that we can do. If we flight instructors identify pilots who have suicidal thoughts, certainly that's something that must be addressed, and you can call 911. And if people are really being overtly suicidal, and particularly if they talk about a method, if they say, I'm going to kill myself with a gun, or I'm going to take an overdose of pills, or I have a method, or I'm going to run my car over a cliff, or I'm going to get in an airplane and crash, those are things that's a medical emergency. It's just like having a cardiac arrest. We wouldn't watch somebody have a cardiac arrest and not start CPR. Well, if we hear suicidal ideation, suicidal planning, that is a medical emergency. And we need to have the pilot, if it's not overtly acute and severe, we can refer them to mental health specialists. Now, it is difficult. I am fully aware that our medical system is not replete with clinical psychologists or psychiatrists, or even there are psychiatric assistants, physician assistants, or nurse practitioners. It can be very difficult to get to those individuals. But if you take away nothing else tonight, know that nationally, all 50 states, wherever you are, if you have a telephone, there is a suicide hotline in the US by dialing 988. It's just like 911, but you can call 988, and that's a crisis hotline. And they may be able to calm someone down, talk someone down, give them some reassurance while we're preparing to get them into the healthcare system. We can, if we know the learner or the pilot's primary care provider, we can make a referral to them, and with their permission, we can actually call their primary care provider and say, I have this learner here, this pilot, and I think they need some intervention or help. We can encourage people in crisis situations to reach out to a loved one or a close friend, and remember that some of this distress that comes to people and presents as mental illness is often a spiritual concern. So we might refer them to a minister or a spiritual leader or a counselor in their faith community that can help. So lots of ways we can refer people to get help. So where does this leave us in summary? Well, again, I can't emphasize enough that if we see individuals who express suicidal thinking, especially if they have a method. If they say, I'm going to kill myself with an airplane, with a gun, with an overdose of pills, with running my car over a cliff, that is an emergency, and it doesn't get better on its own. This is like airport security. We've all been taught when we get our annual training about airport security, if you see something, say something. The same is true about suicidal thinking. If you see something, you have to say something or act, and we have to get those people to the places where they can receive help, and find those places in your community where you know that people can get that sort of help. And just to reiterate, because I know we're not all clinicians on this call, but look for these signs and symptoms. Sleep or appetite changes that are big changes, mood changes, big swings from being high to being low, from being withdrawn, socially withdrawn, not interconnected with other people, not talking, not interacting as they used to, a drop in functioning. They just don't seem to be able to do what they used to do. They cancel lessons. They don't want to take flights. They don't want to come to ground school. They have problems processing and thinking with things like scenario-based training. They're overly sensitive, um, break out into tears, or just the simplest things may become irritating to them or burdensome, if they're apathetic, if they just don't seem to care about anything anymore, if they don't feel that they're part of the system, they're not a member of the school, or they don't feel connected to their instructor, or they say things that just aren't logical. Um, if they exhibit nervous behavior with repeated actions or movements or twitches, anything that appears unusual, or dramatic changes in their school or work performance. All of these things, and this doesn't just have to be in learners. This could be in the pilots that we interact with. This could be in certificated pilots doing their job. This certainly isn't restricted to our learners and our student pilots. It can be any pilot that we interact with, or people who aren't even pilots in our lives that we interact with. Um, the airport personnel or our mechanics or whomever, be alert to these signs and symptoms that can clue us in that something needs to be done. So finally, what can we CFIs do to promote and protect pilots' health? Well, I'm going to say it over and over again. Be alert to these signs and symptoms. Regard mental illness like any other medical condition, without judgment, without stigma. You're not a bad person if you're depressed or anxious or you're feeling suicidal. It doesn't mean you're a bad person, and we shouldn't be judgmental. If we have the opportunity to listen and hear somebody talk about the things that they're wrestling with in their life, we can offer that listening ear. Now, I understand these aren't billable hours for a flight instructor to put on their psychology hat and just listen as a friend, but be prepared to do that and make these early and appropriate referrals. We are not clinical psychologists. We are not mental health professionals. But if we identify these symptoms that we've been talking about, we can get these pilots to the help that they need. And we need to encourage engagement with the primary care physician, with a mental health counselor, with a spiritual advisor, as we said. Some of these people are going to need a psychiatrist or a clinical psychologist. And if the pilot, the person we identify as having signs and symptoms of mental illness, if they give us permission, we should notify their aviation medical examiner and explain to the AME that we have concerns, that we're seeing signs and symptoms that are worrisome, and tune in both the primary care physician with the pilot's scent and the AME if they say that it's okay to do that. So I know that was a lot of material. I'm sure there are questions, but the message here is that we flight instructors can do something to stem the tide of these unfortunate accidents. We need to work diligently to identify these signs and symptoms of mental illness and get these affected individuals to the places in our system that can help them. And I think by doing that, we will dramatically improve aviation safety and hopefully curtail some of these very disastrous and unfortunate accidents.
Excellent, Victor. Thank you. Well, I've been saving a few questions for the end because there's a couple of topics that I think will be really good to kind of tie things together in a nice bow here. The first question comes from Jack, and Jack, you asked a great question that got me thinking. So my apologies in advance. I'm going to build on your question a little bit. Um, Victor's now thinking, what is Aaron up to? But we're taught to look for empirical things as instructors, right? We look at established standards, and we've been talking this evening about things that we observe in learners or other pilots. But a concern Jack has, and I think a lot of people may share this, is what about the things that are not observable? I think we all know or know of anecdotally someone in or near our circle who may have committed suicide, and nobody knew it because they did such a good job of hiding it. And in aviation, I think about that in terms of maybe even reaction formation. Maybe a suicidal person wouldn't share those thoughts in aviation circles in general. So there's a concern there about how do we observe the unobservables? Is there a test? Is there a question to ask? How do we probe our new learners to find issues that might not be obvious? Does that make sense?
Yeah, it makes a lot of sense. And I think some of it is common sense. If someone appears to be troubled or upset, or their behavior has changed, or they don't seem to be the person that we've known them to be, and or it's the first time meeting and they exhibit some of these signs. There's nothing wrong with saying, well, how are you feeling today? Are there things that are troubling you? Are there things that are bothering you? Are there things that we can help you with? Or can you tell me a little bit about your life situation? What's happening with your family? Or if this is a person who's got another job and then they're coming and getting flight instruction, you say, well, are there concerns that you have about your job, about your family? Are your children okay? Are your parents okay? Is there something that we can help you with? So just sort of asking and then the hardest thing to do in these situations is to stop talking. We have to be willing to listen. And it may take a while for a person to trust us or to be able to divulge or share what they believe is very sensitive or even embarrassing information. I had an uncle who was an alcoholic, and it was sort of embarrassing for me to share that information with people. But as I learned more about medicine and saw more people troubled with substance abuse, I realized that this is a prevalent problem, and it's not necessarily someone's fault. And the thing we want to do is not assign fault. We just want to listen with a compassionate, sympathetic ear and saying, are there things that are troubling you? And can we help you with some of these? And can we help you find the resources that can help you deal with these things? I mean, I don't think it's any different than, if someone's having difficulty with crosswind landings, we wouldn't just ignore that and say, well, they're just bad at crosswind landing. No, we'd try to show them. We try to ask them what they were found, what was difficult, and what they needed to work on, and what maybe they weren't understanding about the whole process of dealing with crosswinds. And the same is true with many people just don't know how to deal with the signs and symptoms that they're having. They don't know where to turn. And they need someone to just encourage them to say, well, if your blood pressure was high or your blood sugar was high or you were having aches and pains so that you couldn't walk and you were having arthritis and you needed treatment, we would certainly refer you for that treatment. Well, the same is true for mental illness. We don't have to judge or be judgmental about it. We simply need to listen sympathetically, find out what's troubling them, and then get them to those resources in the community that can help them. And tell them that our goal as flight instructors is to do everything we can to make sure they can continue to fly safely. I think we have to encourage people in that way. And that's what many AMEs are now being taught about depression, that depression is very prevalent. There are very effective and safe medicines that can treat depression. And those pilots that are taking those medications, just like pilots who are taking medications for blood pressure or for type 2 diabetes, they can go back to flying status. And so we have to be not only sympathetic, but we have to be encouraging about assuring the pilot that we will help them to get back to flying status. And it may be a process, it may take some time, but we're going to be committed to helping them to maintaining their ability to fly.
That's a really good segue into the next question, Victor. And I love when a plan works out. So we're going to escalate things a little bit now. Monica asks, I'm going to read her question here because it's really well written verbatim. As a teacher, we see lots of mental health issues, she says. We try to encourage kids to pursue aviation, just like in your STEM program, Victor. Are we setting them up for disappointment if they've had more serious problems, i.e., self-harm, suicidal thoughts, etc., by suggesting aviation? So to distill what she's asking is there a point, keeping in mind everything we're thinking about in terms of non-judgment and compassion and this positivity, is there a point where we're looking at a deal breaker anywhere in here?
There are certain medical conditions, and there are certain exams. If you have serious mental illness that's identified by either your primary care physician or your AME, you may be referred for further analysis with a psychological professional who work with the FAA to identify. And there are conditions, sadly, where if you have them, there are some mental illness conditions where you will not be able to fly, but that's the exception. And the important thing is that we get competent professional evaluation for these individuals. And for the majority of the sorts of usual kinds of anxiety, depression, even attention deficit disorder, there are concerns about attention deficit disorder and pilots having lapses in memory or concentration. But there are guidelines that the AMEs have and that the psychological professionals have that allow even people who have a previous history of attention deficit disorder to return to flying. I was just talking to a pilot a month ago who had a son who was diagnosed during COVID with ADD, and they were working with the Mayo Clinic. This was a Mayo Clinic physician who had this son, and the physician probably rightly believed that the student, the his son, was misdiagnosed with attention deficit disorder. So there are conditions where it will, after evaluation by mental health professionals, the rare conditions where it may not be possible for someone to continue to fly. But in many situations now, there are mechanisms and procedures that the AMEs and the referral psychology physicians can get a pilot to fly. So we can't say that we can get everybody back to flying, but for the vast majority of people with the common anxiety, depression, even substance abuse, if you're treated and are back to health, and we can demonstrate that from medical reports, you can get back to flying.
Great. We just had a thought pop up, more of a thought than a question from Rick. So I don't know if it's a question, but I think you'll probably say amen to this. Um, Rick says, "Let's not forget the other elephant in the room. Don't we, as the instructors, need to seriously assess ourselves for these things?"
Well, yeah, we're not immune. Certainly, you saw those prevalence statistics from the National Institutes of Mental Health. Those surveys, um, mental illness is very, very common. 1 in 5 of us has, in any given year, some signs or symptoms of mental illness, and we flight instructors are not immune. So we need to also be aware of our own symptomatology, and if we're in a situation where we're having severe depression or anxiety or whatever it might be, that we avail ourselves to get the proper input and help that we need and get us to return to health. And again, for most of these conditions, if you're under proper treatment and you have proper evaluation and provide that documentation to the AME, we can continue our roles as flight instructors. But no, we shouldn't think for a minute that this is only about our learners, because we're part of that general population. And 1 in 5 of us every year is going to have some kind of symptoms. Now, for most of us, those symptoms may come and go and not require significant intervention, but occasionally they will. And you saw that in the general population, about 5% of people in any given year may even have suicidal thoughts. I mean, that's a big number, 1 in 20 people having suicidal thoughts in any given year. So, I mean, we've all had we've all had experience where we say, "Oh, I just think I'd like to kill myself." Well, that's just kind of things that we say off the cuff. But if someone says, "I really think I'm going to kill myself. I'm going to go buy a gun and shoot myself," that's a red flag. Or if they say, I have some pills at home. I think I'm going to go home and take those pills and just end it all. Life's not worth living. Those kind of statements, that's a medical emergency, and we need to get those people to immediate help.
So we'll close on the instructor. And this last question, this sort of thing is always the gorilla in the room talking about instructors. James asks, how can we motivate instructors to be psychologically educated, experts at teaching and learning, and good at the verbal and nonverbal communications that most of these strategies frankly require, right? All with the relatively low remuneration that most CFIs have. And I'll add the relatively low motivation a lot of CFIs have to do the job other than than those billing hours.
Yeah, and believe me, I'm fully aware that for a lot of flight instructors, a lot of this activity would be done without compensation. I mean, to read about these things, to learn about these things, to spend time with our learners and our certificated pilots, being that compassionate listening ear, it's a labor of love, and we're not going to be paid for it. Um, but I would hope that we would at least be able to find brief instances of time where we can, through our own self education, the next time we're with our AME for our annual physicals, that we talk to the AMEs about what they're learning about a mental illness and what FAA is doing to help. I suspect, I don't know this for sure, but I think that from the Aviation Rules Committee, we're going to see materials produced that are directed to us flight instructors to help us understand and deal with these issues. I'm fully expecting that that's going to come. I don't know that for a fact, but I would not be at all surprised if that's going to happen.
And something I would add, if I can, and I do say this to my instructor students, when you find that you're not willing or maybe don't have the skills yet to invest in these soft skills and sort of emotionally invest, I guess, in your students and kind of want to do the job halfway, whatever that looks like. It's not just about them. You have to imagine, what if your spouse and kids are in the back and this student you didn't invest in is behind that locked flight deck door and things go sideways? Are you comfortable with this student, this learner you didn't invest in, being up there? And that's a whole nother conversation besides your flight hours and your compensation.
Yeah, and if that's the motivation it takes, you know, that we need to be aware that we prevent these tragedies, and God forbid these tragedies would happen to one of our loved ones or one of our family members, but whoever it happens to, it's going to be someone's loved one or someone's family member, and that alone should motivate us. And if we have to imagine, well, what would it be like to have this person with mental illness being the pilot that, is flying my family member? If that's what it takes, well, then so be it. But I just think we need to raise our awareness and do whatever we can to stem these events as early as possible.
Excellent. Well, this has been great information, Victor. Obviously, very timely, obviously vital, and I know we're looking forward to seeing what the ARC comes up with later this year as well. But now we have some tools even before the regulators take action, where hopefully we can all be better helpers, and we've got you to thank for that. So I think we'll have you back again. You've always been a really engaging and popular mentor live speaker, so we're glad to have you this time, and hope to bring you back again next year.
Well, thank you, Aaron. I'll come back whenever I'm asked.
So next month, another really good one. If you have not seen any of Nathan Ballard's videos or heard him speak, you definitely want to be here next month. He's going to present when a student freezes on the controls, what you need to know. And this is not a theoretical presentation. This is about an incident that actually happened to him and what he learned from it. So you really don't want to miss that one. That'll be on Wednesday, March 20th, same time. As always, open for wings credit. So hope to see you here for that. Again, don't forget, take your quiz. It's just 2 clicks away from where you are right now. Get your wings credit. And don't forget, if you're not a NAFI member, you don't have to be a CFI. Join NAFI. We want to have you alongside us on our mission to make aviation safer by improving flight instruction. So we'll be glad to have you. And I'd be remiss if I didn't one more time thank this month's sponsor, Sporty's Pilot Shop. Thank you again so much, Sporty's, for your support of MentorLIVE and of NAFI. And with that, we went a few minutes over, but not too bad. So we're going to call this a wrap, and we'll see everybody next month for MentorLIVE number 78. Have a great night and fly smart.
Sporty's courses aren't just for independent studying. A comprehensive flight instructor portal connects CFIs with their students' at-home study sessions, making the flight training process more organized and efficient. This suite of tools includes detailed progress sharing with students, lesson plans, a flight instructor refresher course, a complete FAA library, and access to Sporty's courses. Best of all, every feature is available free to any active flight instructor.